So hello everybody, welcome. My name's Matt Camilleri. I am going to host the webinar today, which is on the Clear Community of Practice and the Associate Pool. It's kind of an inaugural webinar. It's something we're trying to kick off and start. So very excited to see people here and interested in it. The idea of today is that we will talk about what the Clear Community of Practice is, what we're trying to do, which is basically bring together a group of like-minded people who are interested in improving services, improving things for patients and for staff in the NHS. We've been doing that for a while now in Clear. I'm sure many of you have been doing that for a while. And we've probably got fairly similar values and ideas about how best to do that. So, getting people together always makes things stronger. So that was the idea about the community practice. And within that, we also have opportunities to work with us at the Clear Programme and 30 on some projects. So we're going to talk through about the associate pool and how that model might work as well. Next slide, please, Maria. So we're going to do an introduction. We're going to talk to the speakers in a minute. This is the agenda for today. So introduction to what the Community Practice Associate Pool, the journey of the Clear Programme, the structure of the Community of Practice. We've got someone here who's worked with us closely before to give their kind of experience. We'll talk a bit more detail about the associate role specifically, and then look at the areas of work that the Clear Programme is looking at in the future, and then we can have any questions on top of that. As Maria's just put in the chat, we are recording, so I hope everyone's okay with that, so just so we can send this out to anyone who's interested and couldn't make it. So yes, I've already kind of introduced myself. I am an anaesthetic registrar, but I also work for 30 in the National Clear Programme. I'm the lead for Strategic Partnerships and Associates, hence obviously involved in this. We've got Alex, who's working with us, who's Chief Operating Officer as a part of 30 in the Clear Programme. Mark, who's Chief Commercial Officer, 30 and Clear. And we've got Emma, who has worked with us very closely in the past and continues to kind of hop in and talk about the work that she's done, and it has continued to progress since she worked with us as well. Who'll be talking to that. She's a frailty clinical nurse specialist at the Hyde Primary Care Network. So next slide, please. Yeah, let's go a little bit into the detail of the community practice and associate pool. Next slide, please. So as I kind of alluded to, the idea of the community practice is that it's a national active community, bringing together anyone and everyone in terms of interested parties that we think are like-minded and are interested in the kind of work that we're doing. It's hopefully somewhere where we can share learning. The National Clear Programme does a lot of work, and we feel one of the things that we'd like to do more is share that learning, and going direct to individuals such as yourselves is really interesting. Hearing from people, who have also done similar work, and learning from them is another key part of that. So it is about just building a community in which we can share ideas, share practice, discuss, some of the trickier elements of how we can achieve making things better for healthcare services, and collaborate, kind of informally, possibly more formally, on projects, and share our practical experience on that. We've obviously got a particular approach and methodology, and as part of that, we're happy to share that and allow that to spread and help people in the roles that they're doing as well. Thank you. And yeah, so the reason we wanted to do this was kind of sustain the kind of momentum and learning from the projects that we're doing, strengthen that shared learning, build a national network, and embed and scale that methodology, because we've found it very useful. It's very effective so far, and the more people that know about it, the better. I guess, why are we different to anyone else? I think we're obviously rooted in a nationally commissioned NHS programme. I think our ethos around co-design and strength in clinical engagement is one that resonates with lots of people, and maybe that's what you've heard about or you've worked with us before and why you're here. I think similarly, the mixed qualitative and quantitative insights give really good evidence and really good substrate for understanding what solutions might be viable and delivering those practical service redesign implementation steps as well, because it's kind of it has to work in real life, and that's something we make sure we do with all of our various projects. And I guess what are the benefits of being part of this community? Well, as we've talked to the shared learning, we've talked to being part of a network, we've talked to sharing the methodology. So in practical senses, that's potentially some learning and other elements in terms of places where we get together and can discuss things. Sorry, the slides have beaten me. I'm going to hand over to Alex to talk about the CLEAR program in a little bit more detail and how it's got to where it is today.
That's super. Thank you, Matt. And lovely to see so many of you here. Many of you will have heard about CLEAR, but for those of you who haven't, CLEAR itself stands for the Clinically Led Workforce and Activity Redesign Programme, if you're a bit creative about where you put the E in workforce. In terms of how it came about, so Matt and myself are both anaesthetists by background, and the programme itself was created by a small group of clinicians who are working with a small group of data scientists back in 2016, 2017. The reason that we started working together was that we had all kind of gone through medical school, been quite bright-eyed, bushy-tailed, quite naive, very much believed in the values of the NHS. And I think all of us at some point in that journey started to kind of really get a bit disillusioned, if I'm honest, about working within the NHS. And that wasn't because people weren't working really, really hard. It was because even though people were working really, really hard, personally, I found that I wasn't necessarily able to do the best things for my patients. So when it's incredibly busy at 4 a.m. and everyone's, going at it in A&E and you're trying to get your patient the right thing, it wasn't that people weren't working to get the right thing, it was more that the system wouldn't let it happen. For me, that kind of came into quite stark relief because I had a relative who became unwell, as many people often have this story as well. That when you kind of see a relative that you're then advocating for as a clinician, you kind of see it much more from the patient perspective. And it was a bit of a turning point in my life to say, actually, if I'm going to work in the NHS, I really, really want the NHS to work and to have a system that actually works for patients and works for the people, the workforce and staff who are working in it. So anyway, a group of us who'd gone through similar experiences all kind of came together and said, we want it to work. We want to we believe in the NHS. How can we make it better? And one of the things we thought of was actually bringing together what we had as clinical insight from the front line and what we knew was out there, which was a lot of data, and how you can bring these things together to really help change practice. We were really lucky at that time because we also had very good connections with Health Education England. And we had a sponsor at Health Education England, or a mentor there, who basically felt that the skills that we were bringing with this kind of clinical insight and data was something that everyone in the NHS should be able to do. So they worked with us to design the CLEAR programme. And initially, the CLEAR programme was really about building that kind of capability within clinicians within the NHS. The programme itself, we wanted it to be an NHS programme. And the fact that we had a sponsor in Health Education England was very helpful for that, because they said, actually, don't bring it entirely into the NHS. Host it in the NHS, but don't bring it entirely in, because the NHS is very prone to restructure. And that was a very, very wise thing for him to have said, because the NHS, as we all know, has kind of undergone multiple restructures since then. So the CLEAR programme, as it is now, is hosted in the NHS, so it's very, very NHS aligned. We feel very NHS aligned, but it is delivered by an organisation called 33N. So that's just to kind of give you a little bit of nomenclature about the differences there. And 33N is, as they say, this small organisation of clinicians and data scientists that deliver the programme. At the heart of what we do is very much that bringing together frontline clinical expertise with data. And the idea is that by bringing those two things really effectively together, you can affect change within the system. So if you move on to the next slide, please, Maria. Why CLEAR exists. So we kind of touched on a little bit about why CLEAR exists and how it came to be where it is now. I think, as I say, as clinicians, I think we'd been on the receiving end of consultancy projects and transformation quite a lot within the NHS, and I'm sure that many of you have as well. And I think the challenge that I had certainly felt being in the NHS was that these change initiatives often, regardless of how good they were, often would sit on the shelf and gather dust if they didn't have that kind of clinical buy-in from the beginning. And so when we designed the program, what we really wanted to do was make it feel different for the people who were doing it. So we wanted it to feel like clinicians were at the heart of it. We wanted people who we were working with to really believe in what they were doing. We wanted to make sure that data and evidence was as available and people had the confidence in that data, and that we could bring this all together to support clinically led decision making. We started off as a small program back in, as I say, kind of 2016, 2017. And by developing this methodology, and it's a very transposable methodology, we've then been able to grow over the subsequent years, particularly post-COVID. And as I say, because it's so transposable, it means that we've done work in both kind of mental health, primary care, secondary care, elective care, so across the whole spectrum. If you go to the next slide, please, Maria. So this gives us a bit of a timeline over how the program has developed. So I won't go through all the details there, but I think it gives you a bit of a flavour of how it grew. So as I say, right back at the beginning, it started off as this group, a small group of people really wanting to make a difference and make change. We worked through, did our pilot projects before 2020, and then obviously huge impact of COVID and the pandemic in 2020. And that really jump-started the need for this kind of work within the NHS, for that kind of clinically led, data-driven transformation work. We then, post-COVID, as I say, had rather rapidly expanded there, and we'd done some work with ICUs. Sorry. And the work itself kind of expanded so that in 2023 we hit a total of 50 projects, and then the following year in 2024 hit 60. And I think I'm going to have to kind of check with Namisha and team, but I think we're kind of 75 to 100 projects now at the end of 2025. And as I say, over this journey, we've kind of moved from our beginnings, which were in urgent and emergency care, and diversified across a whole range of different specialties, because that kind of methodology we use is so transposable. And along the way have met some wonderful people, and I think this is exactly why we really wanted to jumpstart this community of practice now, to bring together all of the enthusiasm that comes out of doing this kind of work. If you move to the next slide, please. So what makes it successful, and what makes it different really from other kind of consultancy work, other transformation work? So very much at the heart of it, as hopefully you've taken from what I've said, is that it's very much by clinicians for clinicians. And I think we really recognise that clinicians, and I can say this as a clinician, I think clinicians can be the absolute barrier to any change if we're not included, but we can also be the absolute champions for change if we're involved. And I think that goes with all our colleagues that we work with as well. So we really wanted to have at the heart of change the clinical experience. And we wanted to make sure that when we were working with organisations, that we were also supporting those clinicians in developing the skills to do this kind of work themselves. Our way of working is also important. So we act very much as a critical friend, not an expert. And this is very much about the way we facilitate CLEAR projects. we don't go in there telling people what to do, but we do go in there and hold the space so that actually the people who are on the ground, who really understand the service, can then provide their experiences and expertise to then move things forwards, innovate and change. And then driving sustainable change. So very much at the core of how we design the work we do is making sure that change is both sustainable long term, so after we've left, it is embedded and continues, but also scalable, so that actually if we do kind of projects in one area, that actually there's shared learning and the whole of the NHS can really benefit from that. Move on to the next slide, please, Maria. I think I'm handing over to
me.
To you again. Fabulous.
Yeah.
Thanks,
Thank
Matt.
you, Alex. Yes. So let's talk a little bit more about structure and participation. So yeah, how this will all work in practice. So as I mentioned, this is kind of the inaugural webinar. We're aiming to do more. Those are going to have a bit more of a focus on the hot topics in healthcare transformation, talking about some of the nitty gritty, some of the experiences people have, and I think probably trying to be somewhat more interactive, so that we can hear from yourselves as well. We want that to be shaped by you, so we'll be reaching out and asking, what do you want to talk about? What are the emerging challenges and innovative things that we could focus on? Ongoing collaboration support. So I guess this is our door is open to look at that. With anyone who's interested, what collaboration can we do at any level? What support can we offer, and opportunities are there? So as I'm sure many of you have found us through, there is a LinkedIn for the National Clear programme, and many of us are on LinkedIn as well. We do have a closed LinkedIn group which wants to focus on that ongoing conversation that we want to have in the webinars, focusing on the kind of work that we're all doing, and pointing out and helping direct each other to interesting topics, innovative ideas. So that's something else. And then, we're also going to be offering updates via emails as well. Just go back to the last slide a second, please, Maria. Sorry. Oh, can't do that. Don't worry. Okay, we'll carry on. So I guess ways to engage, as I mentioned, we've got the quarterly webinars, we've got the emails and the newsletters, and we've got that LinkedIn group as well. Don't worry, Maria, that's okay. We'll manage. And we're going to be reaching out for you to say, what's important to you that we can focus on and try and drive the areas of conversation in. And equally, you can be reaching out to us for ideas, opportunities, support, etc. I think if we go to the next slide now, we've got a QR code. Here we go. So this QR code is to join that closed LinkedIn group, if that's what you would like to do, as well. And not just through that, so you don't have to join this regarding the associate pool. This is more of a kind of a conversation piece, a networking piece, the LinkedIn group. But further to that, is that associate pool element, which we're going to speak to a little bit at the latter end of the webinar. But we'll be putting out calls for interested parties to express their interest in becoming an associate, and therefore potentially looking at working with us on some projects as well. Next slide, please. Great. So now I already kind of introduced Emma at the beginning, but I'll kind of repeat. Emma is a frailty specialist nurse at Hyde in Manchester, and she did a great piece of work with us a couple of years ago now, but that has allowed that to demonstrate the impact of that work, and she's just going to tell us a little bit more about her experience in that process as well. So I'll hand over to you, please, Emma.
Thanks, Matt. Thank you very much as well for the chance to come and share my experiences. So, as Matt said, I had the opportunity to join Clear as an associate back in January 2022 as part of their PCN Anticipatory Care programme. At that time, I was keen to get involved after sort of hearing their approach to develop clinical staff that were delivering roles and services in their area, and to almost sort of give them power back into their hands to be able to shape and inform care and services for their populations in their area. And that was something I'd become quite passionate about. At that stage in my career, I'd gained experience in frailty and dementia care in hospital and community settings, and felt that I had ideas about what could change and what was needed, what felt necessary, but absolutely no clue. It was completely unreachable for me to be able to put forward suggestions and change. So to be able to be then involved in a project that was going to give me, the ability to do that in the local area for the patients I work with, that felt really exciting. So myself and another nurse, Melissa, from the PCN, we were onboarded and introduced to the CLEAR team, which meeting other like-minded clinicians and the CLEAR team members really helped settle us, because as keen as we both were to sort of do a project and be involved in something, we were very much frontline nurses delivering nursing care to care home residents at that point, to try to keep them well and healthy and out of hospital. So it felt completely a world away from, being able to write up a project and a recommendation. So we were really well supported and guided to develop the necessary skills using the CLEAR methodology with support, as I say, from the clinicians, the like-minded people supporting us through. So we found ourselves doing stakeholder engagement meetings and interviews. We found ourselves holding focus groups. We were looking at data from our primary care records and bringing together those insights from stakeholders in our area and the data we could get from our systems to really understand what was going on in our local area and what potentially was needed to try and drive change forward. And as we continued to work through the methodology, we became sort of more confident that we were going to actually be able to produce a piece of work that could be really impactful and meaningful. And by the end, we were really proud of this new model of care that we developed. We knew that it had come from this really robust evidence base, and that it gave us almost an instruction manual of setting up a service, delivering that service, how to measure that service, and what could be achieved by that service. So by the end of that 6-month period, I was fortunate enough the following year to continue to build on our project. After we presented it to the board, they could also see the benefits of this new proposal. And we again were able to really demonstrate that this was developed by us, the people that could deliver the service, with the needs of our local patients and population in mind. And I was given the approval by them to go ahead and implement what was the dementia case management service to practice. So having never done anything like that before, I again called on my newly acquired CLEAR skills to again engage stakeholders, give presentations, share what the service could be, get buy-in locally, setting up systems, and eventually launch the service. I used our CLEAR project very much as like a blueprint and, as I say, like an instruction manual, and I followed carefully our recommendation because again we were really confident in the work we'd done. It was evidence-based, it came from local roots. So although the resource sadly was smaller than the recommendation had been, I had to make some changes, but we got there with the service and rolled it out successfully. Fast forward 2 years from that, and the service is delivering really positive outcomes. It's to its patients and to the wider systems in primary and secondary care. We've achieved outcomes the project said were possible, and that's because we really followed that blueprint. We've been able to reduce unplanned hospital admissions by up to 27%. We've increased GP capacity in our community by 8 sessions a week, and we've managed to save money to the wider system of over £1 million. And when I consider that's work that two frailty nurses from Hyde did, it kind of blows my mind a little bit. I now also find myself in rooms that I'd never have thought possible 5 years ago, contributing to other projects and initiatives. A local stakeholder myself, considered to be, knowledgeable and a leader in this field. So that again, nothing I'd have thought possible from Emma 5 years ago. And that's all thanks to the work I did with CLEAR. Can you move to the next slide, please, Namisha? So just building on that really, before Clear, I'd have never dreamt possible that I could have arrived where I am now and be involved in work of this scale and quality. The combination, I think, of my passion that was there at the beginning for dementia and frailty care, given all these additional skills and development, I've really changed both they've been career defining and career changing for me. And not only did I benefit from my involvement in Clear, Melissa's involvement in Clear, the wider team did. We brought stuff back to the PCN. We were able to do further projects of that nature, working in cardiovascular prevention. And it's, created two upskilled nurse leaders now. And I think the slide that you see in front of you absolutely reflects the skills and knowledge that we gained from working with Claire and doing our projects and implementing that. But I think the biggest thing I've taken away is that being a frontline worker and thinking that you're just going to always have to follow the path and do what we're told and this is how things are, that isn't the case. I've got confidence and belief now that those working in those frontline services, delivering care, delivering services to patients, they're also those people best placed to be able to transform and change things for the future.
Amazing. Thanks very much. Always lovely to hear you speak from our perspective as well, because it's so nice to hear that what we've worked so hard to achieve is coming to fruition in projects like this. So thank you so much.
Thank you.
I think we're moving on to Mark now. Is that Maria?
Got me, Matt? Yes, that's
Yeah,
right. So thank you very much. Hello, everyone. So just going to talk about showcasing the associate role, what it means, and how you can make yourself available. If I could have the next slide, please. Wonderful, thank you. Well, Emma's fantastically given an example of the kind of work you could be getting involved in and the sorts of things that are involved. But let me just give you a quick oversight of that. So we're looking for people who want to work with us as associates to do discrete project-based work using the Clear approach. There's hopefully no surprise in terms of that. The projects can be working nationally, working across a national specialty, working in regions, working in local environments, i.e. ICBs or primary care networks, or primary care networks through ICBs, for example. We have different sponsors in different systems, and depending on how we've secured the piece of work, we very often have national sponsors from NHS England who need work that's programs of work that needs to be delivered, but also we work through the regions and ICBs as well, and as well as some colleagues within the pharma industry. Work spans a whole range of healthcare settings, and Alex, I think later on, will just be giving you a quick update on the kind of pieces of work we've got on the decks at the moment. But as you would expect, it'd be primary, secondary care, preventative models of care, and other multiple clinical specialties. And we've got a kind of a wide variety of work on the books at the moment and in our pipeline. Oh, no, not quite yet. Thank you. The roles in the projects, well, being able to act as an expert in healthcare transformation project work. So that, gives you an absolute clue as to the sort of skill set we're looking for. And as Emma described, being really comfortable in terms of qualitative data collection and analysis and running workshops, undertaking quantitative data analysis using the insights that's driven from our data extraction and analysis, being able to do research and synthesize insights on the back of all of that data collection and analysis, be able to work with colleagues on the front line in terms of co-designing recommendations for improvements and really teasing out of them the things that are possible, or indeed the things they haven't even thought of. And then robust impact assessments. So being really, be able to be conversant in terms of evaluation and the capturing of the impact and the outcomes that we've pulled on. You may ask yourself, how do you become an associate? And the answer to that would be on the next slide. Thank you very much. We have an open expression of interest, year-round open invitation via our Clear on the website. Submitting an EOI, expression of interest, does not imply immediate engagement and does not guarantee a response. But of course, we will absolutely endeavour to respond to everyone. And obviously, you putting in through your expression of interest, we would then engage with you and then work out your suitability. Purpose of the ER process: capture key information from yourself, and for us to be able to build a pool of potential collaborators who we can remain engaged with and call upon to do work as our need and your skills meet. In order to do that, email your CV across to associates@33n.co.uk. Obviously outline your experience and skills and your availability. The nature of associate work is that we're not looking for employees here. We're looking for people who we're able to work with and through on an ad hoc basis as needed. But obviously the CV, it doesn't say covering letter there, but covering letter wouldn't be a bad idea if I were doing it myself. But I believe that to your good selves to respond as you see fit. The next slide, please. Thank you. Assessment, engagement in contracting. So what do we do once we've received your details? Obviously, we'll do a bit of shortlisting based on the experience and the CV that you've given, your prior working relationship, where applicable, and meetings with the Clear team. So we'll, if we've worked with you, obviously we'll know a lot about you in terms of your skills, your ability. But having meetings with the team as well will be incredibly important for us to be able to choose the right people for the job. If you're suitable now, we'll contact you. We'll make sure that you're contacted when opportunities arise. If you're not yet suitable, we'll give you constructive feedback. Obviously, the community of practice will enable you to keep in touch with us and learn more about our work. The feedback obviously will say you haven't quite got all of the skill set we're looking for. We're looking for X, Y, and Z, and that obviously provides you an opportunity to go away and work through whether or not you want to achieve those, get those skills, and work and continue to work for us. So we're looking to be incredibly inclusive through this community of practice. Engagement in contracting in line with Clear standard terms, as you'd expect. And existing contractors, no interview will be required, and engagement is on an as needed basis. But for new people who are unknown to us and new, we may go back one step, please. We may need to have an interview with you to find out more. And base our selection on experience, your experience and expertise. Thank you so much for listening. I will hand you, I think, over to Alex next.
Thank you, Mark.
Just whilst we're handing over, just to let you know, we're having a few problems with the slides, so we're just going to swap over. I'm just going to try sharing the slides from my side and see if that fixes the problem. So we'll just go on to Alex's section.
Thanks, Nimisha. And just whilst we're doing that, just to be clear, for those of you who've applied through the LinkedIn associate pool advert, you don't need to email the associates. We have your CVs, we have your interest, and you're on our list already. So you don't need to do that again. Super. So this is just a brief overview of some of our priorities for the coming year. If you go to the next slide, please. Thank you, Nimisha. So we're particularly, as I said before, it's very transposable, the methodology that we use, but we do have some particular interests for the coming year. One of those is in the cardiorenal metabolic space. So we have done quite a lot of work in the past about CVD prevention. We do have an ongoing piece of work at the moment about CKD, and really the hot topic at the moment is CRM, so cardiorenal metabolic, bringing these things together. This is both looking at it in a kind of neighborhood setting, so thinking about the how we do that left shift of activity into the community, but we also are doing some work in secondary care as well, how secondary care can then support that left shift as well and the expertise required. So cardiorenal metabolic is very much high on our priority list. Women's health is another important one for us. We've done some work in this previously. We're certainly looking to scale the work we've done and expand it as well. Respiratory care, we're also looking at this. We've got a current piece of work that's in neighbourhoods, so thinking about the best model of care for chronic cough and breathlessness, but looking at potentially scaling that next year and thinking about how that dovetails into secondary care as well. Interest in stroke. If you go back to the slide before. Thank you. Interest in stroke, where we've been doing some work also in oncology, particularly in thinking about pathology and diagnostics, urgent emergency care, mental health, and kind of more broadly in leadership as well. We also, for those of you who are particularly interested in kind of digital transformation and the implementation of AI solutions, we have Clear Notes, which is an AVT scribe that we've had really positive results in working with organisations as to how they embed AI in a way that actually really supports the workforce. So will have some work looking at that as well. So if you have aware of any opportunities in any of these areas, please do reach out as well. But this is kind of what we're going to be focusing on in the coming year. Move on to the next slide, please. And we've kind of touched on a few of these already. These are kind of ongoing pieces of work that we've got in the pipeline currently. I won't linger on that too much. So if you move on to the next slide, I think I'm handing back to Matt for a Q&A.
Yeah, thank you, Alex. Thank you to all the speakers. And I guess it's over to yourselves now to see if anyone has any questions, any ideas, anything they'd like to put forward as areas of interest this community to focus on in the coming weeks or months. Nina.
Yeah, I've got quite a few questions. All right.
Okay, go for it.
First one being, do you involve patients when you hold your stakeholder meeting? I know that it's all clinically driven, and that's great because that's how I've done my programs of work. But I just wondered how involved are the patients in this in terms of gaining their experiences?
Yes, very good question. So the standard way in which we normally involve patients is through the organisation or systems we're working with already established channels. So we will get patient feedback that those organisations already received. If we want to go to patients directly as stakeholders, we go to groups that are organised and registered through those organisations. If relevant, we'll be looking at friends and family survey results, complaints, etc. So yes, we do involve patients. It's in a very structured and defined way through existing channels normally, rather than kind of dropping in on patients within that service.
No, I get that. Yeah, I understand. Brilliant, thank you.
Okay. Anyone else? So I can see someone's got their hand up, but I can't see who. Lawrence.
Hi there, that was really interesting, thank you. I've got two questions. One is kind of related to Emma's presentation, which is brilliant, by the way, thank you. Because it's like running a successful pilot is hard, and doing it and completing it is brilliant and achieving the self, but then scaling it more widely is the kind of next challenge. Is that something that Clear actively kind of support with, or is it much more kind of pilot focused?
So I guess in terms of Clear, yes, that is absolutely something we do. And in fact, one of our most successful programs of work is called Living Well, which in a similar way looked at preventative cardiovascular pathways in PCNs. And we went from starting with 4 and we've scaled to 96 PCNs across the country, and it's just finishing off currently. So yeah, I think Emma was a very good example of where that deep dive and that diagnostic and the principles of how to form that care is. And we have then got a process that goes, right, we've got the principles that informs what the model could look like. Let's just spread it to as many places as we can and help them embed it as best as possible in their environment, their workforce, their needs, basically. So yeah, absolutely.
Well, thank you. The other question I was going to ask was about, and I'm kind of worried I've missed the point slightly. Is the purpose of the associates to come with a project to develop, or to provide expertise for supporting projects?
No, the point of the associates is to come as someone able to provide support for projects that we have. That's the kind of aim of the associate pool. It's providing a resource for us. It's providing opportunity for yourselves. However, if you have a project that you would like to discuss, where that's exactly one of the collaborative opportunities we're talking about, we're more than happy to talk to those. Absolutely, always looking to do more good work with good people. Thanks, Lawrence. And Nina, you're back again.
Sorry, I had more than one question, but
You
I thought
did.
I'd give other people a chance to get in first. So my other one was, I'm an associate for another company as well, but I've also got my own company. So if I say you say, oh yes, Nina, can you help us with this? Would I be restricted in working in that particular area for a time period after that project's finished? So is there any clause within your contract that says, okay, you've worked, say, I don't know, for the London for the last 6 months with us. You can't work for them directly for the next 3 years. Do you have any clause like that within your contract? Sorry, it's very sort of business question.
Yeah,
but
it's still an important question. Absolutely. I think I can't speak to exactly if we have that exact clause in our contract. I'd have to go and look at that directly. But I think anything like that is a conversation at the time.
Yeah.
You know,